Hi, everybody. I'm Renza Shabilia from Diabetes Australia, and I'm back with another one of our Tech Talks where I speak very quickly and just for a short time about technology, diabetes technology in Australia. Today, I'm talking about how we can access the different technologies. We have a number of different schemes. There's private health insurance, there's the NDSS, we have an insulin pump program as well. I'm going to talk about all of those and the things that you might want to consider if you need a new diabetes device. Are you able to access it through one of those schemes? And what does that look like? So let's start with blood glucose monitoring, okay? So anybody using insulin will be familiar with the blood glucose monitor. And even for people who are not using insulin, they also might be monitoring their glucose levels. Now, there are lots of different ways that you can access a blood glucose monitor, but the first thing that I would say to you is speak to your diabetes educator. They often have them that they're available to give out to people. Start there. If you do need to buy one, and I know that I personally, a couple of times, have gone on holidays and I needed a new meter, you should be able to pick one up at your pharmacy. But before you go and pay good money for it, do speak to your diabetes educator, to your GP, to the nurse at your GP clinic. They often will have supplies for you. You can also, if you do have private health insurance and you've got extras covered, you might actually have, as part of your extras, they may cover a portion of the cost of one, or every 2 or 3 years, or every 12 months, depends what private health insurance you have. So go and check that out as well. The NDSS, of course, has been in Australia now. It's for over 30 years. It's a fabulous scheme. It stands for the National Diabetes Services Scheme, and part of it is that it provides subsidised diabetes products to people living with diabetes in Australia. So that's how we get the strips for those meters. It's how we get our insulin pump consumables. And also it is how, if you're eligible, you're able to access continuous glucose monitor devices and the sensors, the transmitters and the sensors as well. Of course, we know that not everybody is eligible under the criteria that has been established. Diabetes Australia does continue to work to expand that. But of course, if you are considering a CGM, you do want to make sure that perhaps, check if you are eligible. Great conversation for you to have with your healthcare professional, because they will need to complete the relevant forms. Let's talk about insulin pumps. So we've spoken about pumps before. Insulin pumps are a way of delivering insulin. Now, if you have type 1 diabetes, you may find that there are a number of different ways that you might be covered for an insulin pump. These pumps are expensive devices. They range from about $8,000 to $10,000. They are expensive. So let's start. If you're under 18, there is the insulin pump program. That is an Australian government initiative. It is administered by JDRF. If you Google insulin pump program Australia and JDRF, you will be able to find it. There are obviously different criteria as to how you can, or you might be able to access that. If you are not eligible for that, pumps are covered by private health insurance, and this is where it starts to get tricky. In the old days, I've been using a pump now for 21 years, I think it is. In the old days, you needed private health insurance and you needed basic hospital cover, and that was it. If you had that, you pretty much were guaranteed that you would have a pump covered. Unfortunately, things have changed and they've become far more complicated. Now, it is still to do with hospital cover, the hospital cover part of your private health insurance, but there are now different tiers. Some private health insurance companies require gold tier, some require silver tier. This is one of those ones where you need to go in and speak to your private healthcare fund. And if you're looking at taking out insurance specifically to get an insulin pump, you're going to want to have the conversation of what level do I need to ensure that I can have an insulin pump covered. This is not part of your extras. It is part of your hospital cover. If you give your local Diabetes Australia a call, somebody will be able to help you with that. But the thing you really need to do is go back to your private health insurance and make sure that they are being really, really clear about what you need. Diabetes is expensive, unfortunately. There are lots of devices, there are lots of moving parts, there are lots of consumables. They all do add up. So knowing how you can get the absolute most in subsidies and in reimbursements is really, really important. Hopefully this has given you an idea of where you can go for some of those ideas. You can pop some comments down or questions down in the comments, or give us a call and hopefully we'll be able to answer those as well. But thank you so much, and we'll see you for the next Tech Talk. Thank you.